Hello, this is Angelia, and you are listening to or watching the podcast Why You Do What You Do. Podcast that talks about human development and psychology to maybe help you figure out a little bit more about why you do what you do. And last time we were talking about sexually transmitted diseases, and you should definitely make your young people aware of those and tell them to practice safe sex, because let's face it, they're going to have sex. Better, that it be safe. And today we're going to start talking about infertility. An estimated 7% of U.S. couples experience infertility, an inability to conceive a baby after 12 months of trying. And that's what they consider, as a fertility issue if you've been trying for a year and it's just not happened. Women's fertility begins to decline in the late 20s, with substantial decreases during the 30s. Now, having said that, most psychologists say that you should wait until you're 30 to start having children. Just because you can have children doesn't mean you should, because you might not be mentally and emotionally ready yet. So most psychologists say between the ages of 30 and 35 are the people who make the best parents. They're mentally and emotionally mature, they've got a stable ground under their cells, so then, they are better able to bring other people into the world and be ready for them. Men's fertility is less affected by age, but declines significantly by the late 30s. Everyone starts kind of declining around the age 30. But by age 35, the risks of birth defects and Down syndrome starts to go up exponentially every year past the age of 35. So that sweet spot for having kids is between 30 and 35. So get married when you're 30, start popping them little folks out, stop when you're 35. That's the way to go. The most common cause of infertility in men is production of too few sperm, and you can go to the doctor and they can do a sperm count and figure that out. Although only one sperm is needed to fertilize an ovum, a sperm count lower than 60 to 200 million per ejaculation makes conception unlikely. So, there are sometimes problems with the guy's count. I heard about a couple who was trying, and one of the things they suggested was wearing boxers instead of briefs, that the briefs keep the testes too warm, and that can lead to low sperm count. Sometimes an ejaculatory duct is blocked, preventing the exit of sperm, or sperm may be unable to swim well enough to cross the cervix. Some of that happens too. Sometimes you got some bad swimmers who can't make the journey. Some cases of male infertility seem to have a genetic basis. So sometimes it's inherited, which is funny because, you got here through that way, so it's odd that it would be inherited, but it's a genetic thing. If the problem is with the woman, she may not be producing ova. The ova may be abnormal, mucus in the cervix may prevent sperm from penetrating it, or a disease of the uterine lining may prevent implantation of the fertilized ovum. And that's some of the problems that women have that can keep them from, getting pregnant. A major cause of declining fertility in women after age 30 is deterioration of the quality of their ova. So remember what I said about, especially after age 35, the quality of your eggs starts to deteriorate. So the risk of birth defects, oh my goodness, I'm going to sneeze, goes up once you're over 35. I'm trying not to sneeze. Didn't work, did it? However, the most common female cause is blockage of the fallopian tubes, preventing ova from reaching the uterus. And that can usually be from scar tissue or, other problems, and, problems with other pregnancies or tubal pregnancy. And that's something that you'll have to have usually operated on. In about half of these cases, the tubes are blocked from scar tissue from STDs. So remember, we were talking about those STDs? They can keep you from being fertile. Infertility burdens a marriage emotionally, because a lot of times, if you're really trying and you want to have kids and you can't, then, both partners are like, well, is it me? Is it you? What's going on? Partners may become frustrated and angry with themselves and each other, and may feel empty, worthless, and depressed. Don't feel like that, because there's issues here. Oh my gosh, something's biting my leg. And it happens. So it's better to go to a doctor and get it figured out than to be looking at each other, looking at yourself, and being upset and depressed about it. Such couples may benefit from professional counseling or support from other infertile couples. And there's groups and all kind of stuff. You Google it, go on Facebook, whatever. Hormone treatment may raise a man's sperm count or increase a woman's ovulation. But now hormone treatments sometimes are problematic. They can cause, emotional behaviors. Sometimes drug therapy or surgery can correct the problem. Those are easy fixes. However, fertility drugs increase the likelihood of multiple and often premature births. That's one of the problems that the conservatives have with it, is that you can have multiple births or birth the child too early. But for a couple who wants to have their own biological children, they're probably not that worried about that. They really just want their own child. Also, men undergoing fertility treatments are at increased risk of producing sperm with chromosomal abnormalities. So there are some risks. But again, if a couple wants their own child, they're usually willing to take the risks. New research suggests that couples who have been unable to bear children after 1 year should not necessarily rush into fertility treatments, because, it might take longer sometimes. Unless there is a known cause for failure to conceive, the chances of success after 18 months to 2 years are high. So, if you've been trying for a year, don't give up. Go another year before you start worrying that something's wrong. Among 782 women in 6 European countries, 9 out of 10, even of those in their late 30s, were able to conceive by the end of the second year of trying, unless the male partner was over 40. So, don't give up. Let it go the 2 years. And again, since men's sperm also decrease in potency, once they get older, like I said, if there's a gap there and the men are over 40, it might be harder for you to become pregnant. For couples who give up on the natural way, science today offers several alternatives to parent. That's alternative ways to become parents. Assisted reproduction. Assisted reproduction began in 1978 with the birth of Louise Brown of England, the first child born by means of in vitro fertilization, or IVF, fertilization outside of the mother's body. And I remember that. I was, I think, in 6th grade when that happened, and they called it the test tube baby. So, that's IVF, what they called back in the day test tube babies. So that's what that is. Today, the field of assisted reproduction has mushroomed. There's fertility clinics. There's one, in our city down in the East End. And, I know a woman who has 2 daughters now, little twins, because they went that route. In 1998, more than 20,000 U.S. women delivered with technological help, giving birth to more than 29,000 babies. So, that's a pretty good, piece there. So, if you want your own child, like I say, most people are willing to take the risks and do, whatever they want if they want their own child, I bet. In IVF, the most common procedure, fertility drugs are given to increase production of ova. So, it will speed up your production of eggs. Then one or more mature ova are surgically removed, fertilized in a laboratory dish, and implanted in the woman's uterus. So I'm sure you've seen on TV where they have, the little spear eyedropper thing, and they stab it into the egg and, get the egg fertilized, and then later on they'll implant the egg into the woman. Usually 50,000 to 100,000 sperm are used to increase the chances of fertilization, and several embryos are transferred to the uterus to increase the chance of pregnancy. And that's another problem some, conservative people have with it, is that, if only one egg implants and then the rest come out, then basically it's like a spontaneous abortion for the other eggs. But, since they didn't implant anyway, women have, miscarriages every day, unfortunately. So, the way I look at it is like, if it didn't implant, then it wasn't meant to be. This also increases the likelihood of multiple births. Like I said, the lady I know, she had twins. And I'm sure we all know about Octomom. Many of the women, like Louise Brown's mother, who have successfully conceived in this way, have fallopian tubes blocked by or scarred beyond surgical repair. Again, that's where the egg comes down and comes over and goes into the uterus. So if your fallopian tubes are too scarred or blocked, it's just not going to happen. That's why women who, are looking for sterilization, have their tubes tied. I had mine tied after my third child. And that's the route a lot of people go, so that, if you get too old. I was 32 when I had my youngest one. And at the time, I'd have probably had a few more, but the situation at home was not that great, so I was like, I'm not bringing any more kids into this situation, and I didn't. This method also can address severe male infertility, since a single sperm can be injected into the ovum, a technique called intracytoplasmic sperm injection, or the easy one is ICSI. However, there is a significant risk of transmission of a genetic defect, which increases the likelihood that the resulting offspring will be infertile, because nature is a little more cruel than humans. The conservatives don't think about that. But in nature, if it perceives there's a significant genetic defect, it will not let that happen a lot of the time. And when you're talking about implanting sperm and eggs in, and you're giving her these drugs to keep her fertile, she's more likely to keep that egg and it implant. So actually nature is a little more cruel about survival rates, and if you're in your natural state and it perceives this embryo does not have a good chance for survival, it will go ahead and flush it out. Pre-implantation genetic diagnosis can help ensure that only normal embryos are implanted. And they usually keep an eye on these things, and your doctor can do all kinds of tests to keep an eye on these things. Because like I said, the worst thing you could do is, to finally have been trying for years to get pregnant, and you couldn't get pregnant, and then you get pregnant and then find out your child has serious genetic defects that won't let it survive. So, you want to kind of keep an eye on these things. And some people think that's cruel, that any child's a blessing, but I mean, if the child has to be on life support from the time it's born, like I said, nature would have not usually allowed that. So, artificial insemination, injection of sperm into a woman's vagina, cervix, or uterus, can be done when a man has a low sperm count. So, like I said, they can save it up till they get enough and then put it in there. Even if your man's shooting lazy swimmers. Sperm from several ejaculations can be combined for one injection, enabling the couple to produce their own biological offspring. And like I said, that's the goal there. And if they want their own biological offspring, most people are willing to do almost anything to make it happen. If the man is infertile, a couple may choose donor insemination. So, there are sperm donors. We hear all the jokes about sperm banks. But, if your man is not fertile, you can choose that route and, get a sample from a sperm donor and become pregnant that way. If the woman has no explainable cause of infertility, the chances of success can be greatly increased by stimulating her ovaries to produce excess ova and injecting semen directly into the uterus. So, a lot of times that's what they do. They, give her the hormones that make her produce more, and go ahead and, the joke is about the turkey baster, but it's not a turkey baster. But anyway, they will go past the cervix and inject, the sperm into there in hopes that, one of those ova gets implanted and they can have their own babies. And that's where I'm going to leave you today. I hope this helped you figure out maybe a little bit more about why you do what you do. Excuse me. Trying to talk and cough. It doesn't work, does it? Please like and share this educational program so we can spread it around the world. If you want to help me out, subscribe to my YouTube channel. If you want to help me out even more, go to my Patreon page and become a patron. That's all for now. Until next time.